Good afternoon, everybody. It's Terry Walsh. It's Wednesday, April 29th. This is my weekly update for you. I have a lot of important things to talk about with you this afternoon. I'm glad to be able to spend some time with you. Before I get started on some of the other important things I want to talk about, just to give you a status since last week on our COVID-19 update for both of our campuses. Sunset Hills, still knock on wood, today remains COVID-19 free with no residents or any of our staff at any level of care at Sunset Hills having tested positive for the COVID-19 virus, and we thank God for that. In Chesterfield, the independent living residents and the staff there have also remained COVID-19 free, as well as also in the assisted living unit that is inside the care center. In the care center, as you know, and we all know, we have had some residents who have tested positive for COVID-19. We've had some employees also. The numbers still remain small. As of today, we have about 4 of those residents in the hospital being treated for COVID-19. We've had 3 residents who have been in our COVID care center within the Village Care Center in Chesterfield who have graduated from the COVID Care Center and are COVID-19 free now and have moved back to their normal accommodations in the care center. And today we will have the 4th graduate of the COVID Care Center who will move back into his accommodations today. But there's something special about that particular resident. That resident today, even though he graduates from the COVID Care Center today on April 29th, also today, that resident has his 107th birthday. So Rudy is the resident. Rudy is graduating from the COVID Care Center. He's been through the COVID-19 pandemic. He came out on the other side in good shape. And not only is he graduating, but he is also celebrating his 107th birthday today as he moves back to his normal accommodations. Now, the only request we got from Rudy for his birthday was that he have a lemon pie, and so we are providing that for Rudy. But we want to congratulate him for this amazing accomplishment. And his ability to get through the COVID-19 virus in great fashion. He's still spunky and doing a great job and active and a lot of fun to be around. And we're really happy for you, Rudy, there, and for the team who have helped him come through the COVID-19 virus there in Chesterfield. We have had 3 residents pass away. 2 of them we know were COVID positive. The other one has been tested and was tested for COVID, but we have not even received the result yet. And unfortunately, they passed away yesterday before the test results came back. So we aren't really sure whether they were COVID positive or negative at this point, but we are very saddened at their loss. They had some other complications, and some of the symptoms of the COVID-19 coronavirus kind of tipped them over the edge, and unfortunately they passed. And we are very, very sad that happened. But overall, the team is doing a great job. It's a tough job, but they're very well staffed in the COVID Care Center. We are still working on staffing for the rest of the care center there because the staffing is a difficult thing. One thing I would like you to know is we are working with some of the health systems in town who've been furloughing a lot of their nursing staff, because a lot of clinical offices and other services in some of the hospitals have reduced the work that they're doing because of COVID-19. And so there are a lot of nurses at all levels, RNs and LPNs and certified nursing assistants who aren't working right now. And we are working with those health systems to bring them on board with our care centers to help us with our staffing. So we're working very closely with those, and we hope to begin solving some of our own staffing problems with the literally hundreds of nurses in the St. Louis area that are now furloughed and not doing their normal jobs. So that was a great innovation brought on by some of our senior leadership, and we hope to begin seeing that in the near future. One of the other things I wanted to talk to you about today is the annual rate increase. And I know every July 1st, there's an annual rate increase that we add to everybody's monthly fee, and that time is coming up, and we're required to determine what an annual rate increase is going to be for the following year, and to inform particularly residents in our licensed care areas and the care centers in particular. We have to inform them 60 days ahead of time before a rate increase happens. And so once we do that, then we really have to tell everybody, because the cat's out of the bag at that point. And so we make an announcement, and I'm making the announcement today. We're going to send a letter to every one of you in your in-house mail on both campuses. So Chesterfield and Sunset Hills will be receiving a letter over the next day with the rate increase. But I wanted to show you a chart about the rate increase and how things have been trending over the last 5 years. Before I do that, I do want to explain to you, and I did explain it in the letter that you're going to be receiving, that over the course of the past year, our skilled nursing facilities and our other levels of care have done really great work. They've worked hard at the accolades that they've been receiving from external organizations. Both of our care centers have been named as top nursing homes in America by the Women's Choice Awards, by U.S. News and World Report. We are the first centers of excellence in the entire United States for the Pathways Interact program, which is a company and organization that works with Medicare to reduce unnecessary readmission rates for patients who have come back from the hospital after a hip replacement or some other procedure. Our teams are very well suited for managing and taking care of those residents and not having to unnecessarily send them back to the hospital. So out of 16,000 skilled nursing facilities in the United States, ours, Friendship Village at Chesterfield and at Sunset Hills, were the first 2 centers of excellence in the entire United States for their work in reducing unnecessary readmissions. So a lot of work has been going on over the past year. In fact, today we also learned that the skilled nursing facility, the Village Care Center at Sunset Hills, achieved its 5th star again from Medicare. You know, last year both of them were 5 stars until Medicare moved the goalpost last April. And both facilities have been working very hard to regain that 5th star again. And as of this morning, the Sunset Hills Village Care Center re-achieved their 5th star, and I'm sure that Chesterfield is very close behind and will be doing that as well. But we are going to have to impose a rate increase again, like we do every year. And I do have a chart I want to share with you just to show you what that looks like. And what I want to show you is on this side of the chart, the tall blue line was the rate increase that was imposed upon the residents in 2016, which was 5.25% rate increase. Those of you that were here at that time know that. If you've moved here since then, you don't remember that rate increase, but in 2016, there was a 5.25% rate increase that was imposed on July 1st. The following year, after we started into our internal management, we were able to reduce the rate increase to 4.9%. And then the year after that, we were able to reduce it again to 4.4%. And last year, you know that our rate increase was decreased to 3.9%. And I will tell you that there's a lot of uncertainty right now with the COVID-19 expenses, because we do spend money on trying to keep you safe, and with all the security guards and all of the equipment and the thermometers and the hand sanitizers and all of the things that we're doing to try to keep everybody safe and away from the COVID-19 virus. Our teams have still been working very hard to be as efficient as they possibly can and to keep the costs down. We buy things together now. Both villages purchase things, so we're able to leverage our purchasing power together to be more efficient and cost effective in how we buy things. We also are able to move staff a little bit more freely between the campuses rather than hiring new staff here and there. And we share a lot of those resources and leadership positions. But still, we have to give a rate increase because our costs still go up. But I wanted to show you this chart because this is the first time you're hearing now that our rate increase for fiscal year 21, which begins on July 1st, is going to be 3.75. Our rate increase is going to be 3.75. But I wanted to show you this chart to show you that we work hard every year to bring that amount of increase down as far as we can. But even with the uncertainties of the COVID-19 pandemic, we think, and we're very confident that we will be able to still maintain our financial strength through next fiscal year with reducing the amount of the rate increase that we need to impose on July 1st of this year. But I wanted to show you that our efforts for the last 5 years have been bringing that amount of rate increase down every year consistently for the 5 years. Do we wish it could be less than that? Absolutely. Can it be less than that? This year we can't afford the risk because of all of the uncertainty with the market and COVID-19, but we do feel confident that that 3.75% rate increase being less than what it was last year will still get us where we need to be. Hopefully next year we can do it again, but we are at least happy that we're able to drop it a little bit further again this year. We would like it ultimately to be zero, of course, as would you. And we understand that everybody is wrestling with the market decline because of COVID-19 and the shutting down of the economy. Then we know it's a challenge for everybody, and as well as it's a challenge for running the company. In addition to that, so we're working together and we're doing everything we can to keep our costs down. But you will be receiving a letter in the mail either later today or tomorrow explaining and outlining again the rate increase that will be started on July 1st. And I appreciate your understanding of that. We really wanted to bring it lower than that, but that's as low as we can get it this year with all of the uncertainty that we're facing. And I appreciate everybody's understanding of that situation. Tomorrow will be the last day, sadly, for our executive director of FV at Home, our home health agency. Melinda Ward is leaving us tomorrow. I think I mentioned that last week on my update. But Melinda Ward, who's been the executive director of our FV at Home home health agency for the last 9 months or so, is moving back home. Her family, who we had originally anticipated following her to St. Louis, hasn't been able to do that because of COVID-19 and the job market and all of those other things. And so the only alternative that Melinda had was to move back to Kansas City, where she has lived and where her family has been even the entire time that she's been here. We're very sad to see her leave because she really did great things with the agency to get it up on its feet. It now has triple the business, the census that it ever had before we bought it. She's done a great job. In December, they received one of the best inspection results in the entire state of Missouri on their 3-year inspection. So she's leaving FV at Home in very good hands and in very good shape. She's leaving it better than she found it. And it's going to be taken over now, at least on an interim basis and perhaps long term, to a 30-year veteran in the home health industry who's been working in FV at Home for the last couple of months. Her name is Janie Sands. You will get to know her over time, but Janie is very well qualified for this role. She's been working in home health and hospice for, again, 30 years. She was a great find for us to be the director of nursing, and she'll be the acting executive director for FV at Home until we decide to make her permanent, if she wants to be permanent, after about 90 days or so, and we'll make that decision and continue moving forward. But overall, our FV at Home program continues to do very, very well, and Melinda is certainly leaving it in better shape than she found it. As you also know, Mike Hambley, who is the executive director of Friendship Village in Chesterfield, is also leaving us, and he's leaving at the end of May for an opportunity to kind of sort of go back home to the place where he raised his children in Wichita, Kansas, for an opportunity there that is literally something he can't pass up. And we certainly understand that, and we support Mike. We're going to miss Mike a lot. He's done a lot of great things over the last 3 years for Friendship Village in Chesterfield, and a great partner to me in our senior leadership team across the board for all of the things that he's done to lead the staff and the residents in Chesterfield. We're going to miss Mike tremendously. It's going to take us a little bit of time to recruit a full-time replacement for Mike, because we want to be very careful and deliberate about that process. We can't just stick anybody in that job, because it's a tough job and they have a lot of responsibility in taking care of our residents. And so we have to do a great job of finding just the right person for that. In the meantime, though, I will still be overseeing, obviously, the entire company as well as Sunset Hills, but we have asked Carmen Franzak, who has been our Chief Strategy Officer and responsible for all of our sales and marketing programs across the entire enterprise. She's going to be serving as the interim executive director for the Chesterfield campus while we go through the search process for a full-time replacement for Mike. So you have probably seen Carmen Franzak. She is excited about doing this. This is something that she has been wanting to gain experience in doing. In operations, she is uniquely qualified to do this. She knows our product. She knows Friendship Villages backwards and forwards. She is heavily involved in our senior leadership team and working on a lot of the strategic initiatives that we've had in place and that we've been working on for a while. But she's going to be spending almost all of her time on the Chesterfield campus. I will be floating back and forth. I'll be working very closely with Carmen on managing both campuses, but Carmen is going to be in the position as the interim executive director in Chesterfield, and she'll be there on a regular basis to work with you as the residents in Chesterfield and with the staff there, and to represent me during this period of transition as we look for Mike's replacement. So I encourage you to welcome Carmen as you see her there. She will begin showing up on campus more frequently starting next week and working with Mike and learning some of the nuances of the Chesterfield campus before Mike leaves. And then toward the end of May, she will be a permanently, or not permanently, but at least interim, in Mike's seat in the office there. And she's the person you'll be seeing when you have issues that require the executive director. Of course, Wilma Searcy is still there. But both of them, Wilma and Carmen, will be working together, and I will be attached also in helping Carmen with the management of the campus while we're doing that search. So I appreciate everybody knowing that and understanding that. Carmen still has her other job to do as the Chief Strategy Officer, so she's going to have quite a lot of work to do. I'm going to help her with the management part of it, but she'll be the face on the ground during that period of time. One of the exciting things I wanted to announce to you is, first of all, we're very proud of everybody's efforts in the no contact policy, the stay at home rules, the social distancing, the wearing of the masks, all of those things that we've been asking everybody to do. The no visitor policy has been very onerous for everybody. Nobody likes it. Your families don't like it. I don't like it. The staff doesn't like it. You don't like it. Nobody likes it. But it's hard to argue that it hasn't been successful. So it's been working. We've been successful at trying to keep the COVID-19 virus away from you, and we intend to continue doing that. But we are going to have a little bit of a celebration on Mother's Day. And we are going to arrange and invite your families, and I invite you to invite your families to join your campus in a one-time parade around the campus where your family members can be in their car, and when the green light turns green, they will be allowed to have a parade around the campus where independent living residents can come out and sit on the sidewalk and watch your families drive by. We will be able to provide you some poster making materials if you like that, so that you can hold up a poster for your family to say hello, and hopefully they'll have some posters to say hello to you, and honking the horns and having a great time on Mother's Day at a certain time. And we will post those times for you. We will still have our security guards at the front entrances to the campuses. So no families will be able to come in until it's time for the parade to start. They will be asked to line up outside the campus gate, and we will identify all of those locations, but line up outside the campus gate, and at the appropriate time we will open the gate, and we will have a parade marshal essentially leading the procession of all of the cars around the campuses, and you will know then when that's going to be, so that you can be outside or on your balcony or wherever you want to post yourself, obviously still maintaining social distancing, but be able to have an opportunity to see your family drive by with the windows open in the car and waving at you, and everybody saying hello and honking the horns and having a good time, but still maintaining a no contact policy. So we want to do this. We think it's going to be fun. You've got about a week and a half if you want to make a poster and get all that ready. Call your families and let them know. We will be publishing the instructions and the rules very soon so that everybody will know what those are. But there will be a set amount of time that this parade will happen. So for example, at Sunset Hills, the parade will begin at 1:30 in the afternoon on Mother's Day. So the families who want to participate will have to be lined up in a line outside the security guard position before 1:30 so that they're ready to go. But then when the time comes, we will open the gate and then allow the parade to drive through the campus. Now the rules will be that you as residents will have to maintain social distancing from each other. You'll be able to be outside on the sidewalk, but positioned far apart, 6 feet apart at least, from each other. And your families and loved ones who are driving by in the cars won't be able to stop. They'll drive by very, very slowly, but they won't be able to stop. You won't be able to run across the street to their car and reach through the window and give everybody a hug and a kiss. I know you want to, but we still have to maintain our no contact policy because we do not want to get the COVID-19 virus on the campus. And I think we all understand that, but this will give everybody an opportunity to see your families. I know you haven't been able to do that. It gives them an opportunity to see you. Everybody will be able to make some noise and celebrate a little bit at a distance from each other, but an opportunity to bring everybody together in kind of a fun atmosphere on Mother's Day. And let's pray that the weather's good and that all works. And if it doesn't work out because of the weather, then we'll come up with an alternative date. But we will pray that Mother's Day weather is beautiful and that this will work out. Again, we will provide more detailed information on how this is going to work. It's being developed now, and we will make sure that everybody is very clear on how this is going to go. But our primary concern is that we maintain the safety of our residents through the no contact rules and the social distancing rules. But we do want to open up the campus at least this one time to allow everybody to be able to see their relatives and have a little bit of fun on Mother's Day during those days. The care centers, the skilled nursing facilities, the care centers, and Fountain View Assisted Living are going to have a little bit different process because those residents can't all come out to the sidewalk for obvious reasons. So there will be a little bit different process for the care centers and for assisted living. And that will be disseminated to those families separately. But for independent living, that's the big day. And you kind of have 10 days to get a poster ready if you want to do that. I encourage you to do that. Let's have some fun and take the next 10 days to get ourselves ready for the big party, even though it's going to be a no contact party and social distancing is the rule of the day. But I think it's going to be a lot of fun for everybody. Our staff continues to work very hard. They take risk every day. They come to work from points unknown to us. They come from their families, their homes. They've been to the grocery store. They've been to the gas stations. They have households to run. They have families to be with. And so there's a risk out there, as we all know. And they come to the campus. They're instructed to let us know if they're feeling any symptoms before they even get in the car to come to work. We intervene if there are any of those conditions. We send them off for testing as well. And we tried our very best to keep our staff clean and COVID-free as much as we possibly can. 95% of the time, we're very successful at that. We've had a couple sneak through, particularly in the care center in Chesterfield. We jump on those immediately and try to mitigate that and keep them home and quarantined. But this virus is sneaky and it's invisible and it can go wherever it wants to go before you even know it went there. And so this effort is ongoing. It never stops for us. But our crew, our team, our employees, and our staff know the risk and they take the risk. And they want to do the best they can for you. They do it every day. They're doing everything they can possibly do within the resources that we have and the capabilities that we have to provide the best in care and services for you. I know that you appreciate that. I know that we're beginning to work on some projects where you can express your appreciation for what our staff is doing, either through a quick video thank you or gifts perhaps on our online website donation button. And if you haven't been on our website at friendshipvillagestl.com, again, that's friendshipvillagestl.com, I encourage you to do that. That's a great place to see the updates that I write almost every day on what's going on the campuses with COVID-19, plus a lot of other information in there. I encourage you to invite your families, if they haven't been on our website, to look at our website once in a while to stay updated on things. We continue to provide all the services and new alternative ways of entertaining you or conducting fitness classes and other things online and on Zoom, and even some games on Zoom. I'm understanding that more residents are participating in the fitness classes now in their own apartments than they ever did in the classrooms because there's nobody judging them in their apartments. And so I'm understanding that a lot of people are doing that and enjoying that. And that might be something we keep doing after the COVID-19 pandemic is declared over. I wish I knew when that was going to be. I know that the state of Missouri is going to be relaxing the stay-at-home order starting next week on a statewide level. But we also know that St. Louis County and St. Louis City are not yet relaxing the stay-at-home order. And as much as I hate to say it, neither are we. Friendship Village is not relaxing our no visitor policy either. So we are still going to be maintaining our no visitor policy. That's why we're really looking forward to the Mother's Day parade as an opportunity to at least see your family briefly and have a little bit of fun yelling across the street to them in their cars. But we are not going to mess with success right now because the COVID-19 virus is still out there and we don't want it in here. And so we are still going to maintain our visitor policy until we really think that the coast is clear, and we don't know when that's going to be. Just because the state picks a day on the calendar to reduce the stay-at-home order, that does not mean that the risk is gone. And as we all know, and we all watch the news, senior living communities are at the highest risk for the corona-19 virus. And so we're going to maintain our vigilance in trying to avoid that on our campuses. So we are not relaxing the no visitor policy on the same day that the state relaxes the stay-at-home order. We can't afford to do that. We won't be doing that, but we will be able to have our Mother's Day parade and maybe something else like that. If that's successful and we do a good job of that, we might be able to do that a little more often. in the future, but I know a lot of you have questions about when we're going to stop the no visitor policy, but we're not stopping the no visitor policy anytime real soon. We will do it when we can, but we can't afford to do that now, and we would not do that to you and put you at that risk. And I appreciate your understanding. I know that's not what all of you wanted to hear, but I think it's best for all of us to maintain that. We still do fall under a lot of the regulations for senior living communities, and there still are rigid national no visitor policies for skilled nursing facilities, which kind of, in our case, translates somewhat to the rest of the campuses, and it's important for us to be consistent in how we do these things at all of our levels of care as much as we possibly can. But we do hope that you do prepare yourself for the Mother's Day parade. Even if you're the dad and there's not a mom right now, you can still be out there, and we'll have a joint Mother's and Father's Day parade on Mother's Day. We hope everybody can get out there and make a little bit of noise and wave some signs and have a good time with everybody. And I hope that you're able to do that. We will have a lot of staff around to help maintain the no contact policy. We are serious about that. And I know there will be some residents who will have the strong desire to bolt across the sidewalk and onto the road to say hello to the family close up, but we can't do that. We've got to manage ourselves and maintain our composure. But you can certainly wave and scream and holler and make some noise from a little bit of a distance. And I hope that you're able to do that. I encourage you to do that. And again, we're going to get some more detailed information out to you so that you can pass that along to your families as well. But I think it's safe to say right now that there will be that opportunity on Mother's Day, assuming that the weather will be good. And you could probably give them a little bit of a heads up that on that Mother's Day afternoon that they will be able to drive through the campus and honk the horn and wave out the window and maybe show some signs and posters that they made expressing their longing to be back with you. That's all I have today. I hope this has been helpful. Again, you will be receiving a letter in the mail soon in your in-house mail about the rate increase. We've done everything we possibly can to keep continuing to reduce the amount of the increase every year. We're able to do it again one more time for next year. It's not a huge cut. It's not as big of a reduction in the increase that we wanted it to be, but it's a reduction nonetheless. And it's a reduction that at this point, with the uncertainty of the COVID-19 pandemic going on and the costs and all of the things that go into that, it's the safest number we think we can have for this year, and we hope to be able to do more next year. We've done that for 5 years in a row now, and we hope that we're able to continue that in the future, and we're glad that we're able to at least do it a little bit this year as well. So again, thank you for your attention. I'm glad I'm able to spend this time with you today. I hope that you have a great day. I will be seeing you around this campus and the Chesterfield camp, this campus being Sunset Hills, and the Chesterfield campus. When you see Mike, wish him farewell. He's still here for another month. And when you see Carmen Franzak, who will be shadowing Mike soon and then for a while on Chesterfield, I hope that you welcome her. And then thank the staff. And if you have an opportunity to thank the staff in your walks around the campus, I encourage you to do that, because that means a lot to them for the work that they're doing and the sacrifices that they're making, leaving their families and coming to work every day to take care of you. Again, I hope you have a great afternoon. I'll see you again soon. And I really encourage you to get ready for Mother's Day, for the Mother's Day parade. Have a great